As a doctor who does Social Security disability exams, something people often say to me is, I don't know why I have to go through this process. It's all in my medical records. And I think to myself, if only that were true. Actually, it's kind of good for me that it isn't true, because if everything Social Security needed to know was in people's medical records, I wouldn't have a job. Nevertheless, medical records are the number one most important thing in a disability claim, and the number one reason Social Security denies disability claims is inadequate medical records. So although the topic may sound boring, I think this may be the most important video that I make for people involved in the disability process. I'm going to describe a little bit about the history of records, what's in them and what isn't in them, problems with them, and how you can make it easier for Social Security to understand your records, find the important information, and hopefully approve your claim. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. And if you find this sort of thing interested or are involved in the disability process, you may want to subscribe to my channel. I generally put out a disability-related video every Friday. Now, in the old days, there were no medical records. Doctors just did what they needed to do and went on. Initially, medical records were for communication, mostly in the hospital, between the doctors and nurses and specialists, and to jog doctors' memories. And initially, medical records only contained important information. Very early in my career, I worked a little bit with a doctor named Bill Wilford, who was one of the last of his breed, a rough and ready general practitioner who did it all, delivered babies, did surgery, treated heart attacks, wrestled with violent drunks in the emergency department. Not only that, but he was a World War II veteran of the Royal Canadian Army who kept his .303 Lee Enfield rifle and .455 Webley revolver he'd used to fight the Nazis in his basement. And his office records consisted of a 4x6-inch index card handwritten on each of his patients. And I thought that was a little bit too short. At that time, hospital and clinic records were all handwritten, and doctors and nurses tended to only put in information that was important for the care of the patient. Then things started to change. The first big change was that American society became litigious. Americans began suing everyone for everything, and doctors became targets of malpractice cases. So medical records started to become bloated with what's called defensive information, information that wasn't intended to communicate important health information, but was intended to help in case the patient sued the doctor. Next, the Center for Medicare Services set standards for medical billing. And it would have been nice if the standard had been reasonable, but they included all sorts of nonsense that had to be included in the medical records, or doctors did not get paid for the work that they did. And most insurance companies followed the CMS's guidance. For example, to get paid for a certain level of exam, you had to include a family history, conditions that ran in the patient's family. Now, if you were seeing a middle-aged person with chest pain, it's very helpful to know if any family members have had heart attacks or died of heart disease. But if you're seeing a young man with multiple broken bones from a motorcycle accident, knowing the family history is a waste of time. But you have to include it. Then, CMS required digital records, computerized medical records. Again, I think with good intentions, but suddenly people realized that they could use pre-populated templates and cut and paste to generate enormous medical records that never would have been generated if they had to handwrite the information. And finally, and I hope this is the last nail in the coffin, I'm sure something worse is coming down the pike, CMS required patient portals where patients can read their doctor's records, and press Ganey surveys, patient satisfaction surveys, became a standard. And all of a sudden, every doctor had to kiss their patients behind in every note that they generated. Something that a lot of people don't realize is that medicine isn't Burger King. You don't always get to have it your way. If I have an alcoholic patient in the hospital and he requests a quart of vodka, I'm going to say no, even if that makes him unhappy. Doctors have to deal with a wide range of people: alcoholics, drug addicts, criminals, violent people, the insane, wife beaters, husband beaters, spouse shooters. I've had both a husband shooter and a wife shooter, child abusers, etc. Sometimes you have to write unflattering things, the sort of thing that make the patient irritated and give you a bad survey, in their records. So here's the problem. Modern medical records are colossal, enormous, often way more than 1,000 pages, and they're 99% useless nonsense. Looking for pertinent information is like looking for needles in a haystack. Here's the best example I can give. I recently reviewed an emergency department record from a patient that I was treating, and the emergency department record was printed, small print, and 12 pages long. And the diagnosis was the common cold. This doctor and hospital had generated a 12-page record for someone with a cold. Bill Wilford would have written 2 lines. In the old days, when I wrote my medical records, I might have written a paragraph, but that would have been it. And the Veterans Administration is the all-time champion of enormous medical records. They duplicate, they use templates, they cut and paste like they've gone wild. Looking for pertinent information in VA records is like looking for a needle in a 3-story high haystack. So, what does this have to do with disability applications? Well, when you apply for disability, Social Security requests the medical records from all the doctors and hospitals and clinics you've listed. But first off, these entities are under no legal obligation to provide the records to Social Security. They may or they may not. You want to check with your caseworker. Have they gotten all your records, especially the most important records related to your disability? If they haven't, you can go to your doctor's office or to your hospital and clinic and request copies of your records, and they are obligated to provide them to you. However, they may charge you a reasonable fee, usually so much per page. Or you can go to your patient portal and print out your doctor's notes and your test results. Now, if you do this, one thing that I suggest that you do is, before you send these records in to Social Security, go through them and take out anything that you think is not important, that's not related to your disability. For example, if you're applying for disability for arthritis, and you go to your doctor's office and get all your records, and you find that one of your visits was for poison ivy that got better, leave it out. That's not related to your disability. Likewise, if you went to the ER at the hospital because you cut your finger on a broken glass when you were washing dishes and got stitches, leave it out unless that cut left you permanently disabled. Because medical records are often so huge and impossible to find the best information, Social Security personnel who are overworked are not going to read your entire medical records. It's impossible. They don't have weeks or months to read every word of thousands of pages. The chances are high that they're going to skim through them looking for the pertinent information, and they're probably going to miss some of it. If they can't find the information easily, it's easier for them to just deny your claim than to spend more hours that they don't have searching for the information in your records. Another problem with medical records is that they often, although they often have notes on your diagnosis and treatment, don't include information on your work-related abilities. For example, the doctor may have put in the notes that you have arthritis in both knees and have a limp, but I have never, in my 50-plus years of practicing medicine, seen a note where the doctor made a remark on how long the patient could stand, or how long or how far they could walk, or if they had trouble going up or down stairs. Information that's very important for Social Security. Now, the most valuable medical records are, number one, specialists' consultations about your disabling problem. Social Security puts top priority on specialists' opinions about your disability problem. Hospital admission and discharge notes if the admission was related to your disability. Operative reports, a surgeon's report of an operation if the operation is related to your disability. Pathology reports, when something is removed from your body, like tissue or an organ, it's sent to a doctor called a pathologist. And that pathologist does tests on the tissue and looks at it under the microscope to figure out if it's healthy or diseased, and if it's diseased, what sort of disease it has. For example, they're involved in determining if a tissue has cancer or not. Pertinent tests, tests related to your disability. Examples would be, if you have a joint problem, X-rays or CT scans or MRIs or ultrasounds. If you have a liver problem, it would be blood tests related to the liver, ultrasound of the liver, and a pathologist's report on a biopsy of the liver, where a doctor takes a small amount of liver tissue from you with a needle. So, here is my best advice for you. Number one, if your problem is very simple, you don't need to do this. An example would be somebody who had one stroke and is paralyzed on one side of their body. That's very simple. Not much in the way of medical records, and Social Security can easily make a determination. But if you have multiple problems, if you have complex problems, if you have huge medical records, I strongly suggest you do this. And I was prompted to make this video by a comment from a veteran who's been very helpful to me, who told me that he had had 984 pages of VA records sent to Social Security, and he decided to summarize them. And he said his caseworker was very pleased. Likewise, I was scheduled to see a young woman who'd been born with a genetic condition that affected all different parts of her body, and she had had many operations to try and correct some of the problems. And when I got there, her mother had made a 1.5-page typed summary of everything this young woman had gone through from the day she was born up until the time I was seeing her. It was wonderfully helpful. Here's what I suggest you do. I suggest you summarize your problems. Go problem by problem. Start with your most disabling problem first. What you want to put in is, when did it start? You don't have to give an exact date unless it was in the last year or two. What your diagnoses are. Pertinent test results. Pertinent doctor's visits. Also visits, for example, by physical therapy or occupational therapy or chiropractors. Pertinent surgeries and hospitalizations. Do not write. Type this or get it printed. It should be maximum 2 pages long. Send it certified mail to make sure that Social Security gets it. I can almost guarantee you that this will really help your disability claim. Finally, I'm going to give an example of what I would do for a person who has severe arthritis in both knees. When started? I started to have pain and stiffness in my knees about 10 years ago. Diagnoses. I've been diagnosed with severe osteoarthritis, bone on bone, in both knees. Pertinent test results. My most recent x-rays of both knees was last October, and it showed severe osteoarthritis, severe joint space narrowing, both knees. Pertinent doctor's visits. I have seen in the last 2 years a rheumatologist, an orthopedic surgeon, physical therapists, and I've had injections, anti-inflammatory medication, opioid pain medication, and physical therapy. The orthopedist recommended I consider knee replacement surgery. However, a good friend of mine died on the operating table during knee replacement surgery, and this has made me very nervous, so I decided to avoid the surgery if at all possible. And I have not been hospitalized for this condition. I could put all of that on one typed page, and believe me, that would help a disability application. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.